Hey guys, I'm excited to talk about this today. We're talking about insurance. Woo! Really exciting, but we're actually talking about how insurance isn't what it used to be. It's not your mom and dad's insurance where you pull out the card and everything's covered. Unfortunately, it's been relegated to something different, which is that card represents something, but what it actually represents is likened to the shell game. If you go to New York City or any major metropolis and you see the guy moving around the cups, what's under the cup? And we've broken this down for you today and talked about really what does this look like in the game of insurance and where's the ball under the cup? The ball is, am I getting covered? What am I getting for my benefits? And when do I actually get to use my insurance?
Hold on, before you dive into this, it's funny because when you think about the healthcare system that you have, this shell game analogy could apply to so many different things inside of this healthcare system. But really, one of the things that just makes me so angry on a weekly basis in the clinic, right, is just the insurance industry in general. And I would venture to guess similar to like the airline industry. I don't hear anybody really coming back from the airline industry being like, it's just amazing. And listen, I have actually had some lovely experiences on, some Delta flights or some different flights like that. But generally speaking, I don't know that I've ever met anybody who sat down and been like, I've heard people say I have good insurance coverage, but I've never heard anybody be like, I just love the insurance industry. I just love my health care insurance. I love the experience of how much I pay and what I receive, in terms of health insurance.
I know people who work in the healthcare industry that love that they have a great job, love that they maybe make a great salary, but they themselves admit it's so messed up and I don't love the healthcare industry.
Yes, the health insurance.
It's funny you bring up flying on a plane because I feel like it's actually gotten to be kind of the same. In fact, I think if we really are honest, a lot of things in our current just economic model have gotten to this point where what you think you're going to pay isn't what you're going to pay. Yeah. And airlines are definitely one of those. You want to wear
shoes on the plane? You want to wear a belt on the plane?
No. So I'm even thinking like you're going to book the ticket and you're like, all right, these are the times I want to fly. And so you go, okay, what's the cheapest flight? And you see the cheapest flight in the times you want to fly. And then you make a decision. Do I want to spend $50 more for this airline versus that airline? But ultimately you end up choosing based on that price. But once you click that price, depending on the airline, do you want a seat?
Yeah.
If you don't just want one we're going to give you, you want to pick your seat, that's $40.
Yep.
Oh, did you want to bring a bag?
Yep.
Oh, sorry, your bag's $65. Oh, you want to bring not a carry-on, you want to bring like a big bag. Oh, that's $100. Like by the time you're done, the price is almost double. And this is kind of what we're talking about when it comes to insurance. But when we think about the shell game, the 3 cups, and I broke this down, it's pretty simple. If you have insurance, you know this game. Premium, deductible, copay.
Yep.
Right? Premium, deductible, copay. So your health insurance has those 3, and those cups are constantly moving. And underneath that is the actual one thing that you're concerned about, and that's what am I going to pay to get the services I want, ideally the results I want, but the reality is results are based on whether you can get the service. So what am I going to pay to get the services I want? Most people never find out what they're actually going to pay until the cups stop moving.
Yeah.
And so I drew out a map on this, and today I just really want to talk about healthcare coverage and the healthcare coverage that you think you have. Remember the day when I remember this growing up, when people had really good healthcare, it was like you just went in and you waved this magic card around and everything got covered.
Yeah. Yeah.
People are like, do you have dental insurance? Oh, we have dental insurance. Covers our dental.
Right.
Do you have vision insurance? Oh, it covers our vision. We have really good, we just have, we have Blue Cross Blue Shield or whoever the company is, and it's all covered. Well, I think we've all realized that those days aren't the same anymore.
I remember when I was young, my braces were covered on my mom's, healthcare insurance. Yeah. We didn't pay out of pocket for them. So those days are so long gone. So long gone. It's not even funny.
And I don't want to tell you what we like in an insurance card too just yet. We'll talk about that in a minute. But gone are those days where insurance simply covered things full stop. that we're to the point where what you're holding in your wallet really isn't insurance the way that our parents understood it.
Yep.
That we're playing this game, and we want to lay these 3 cups on the table. So what are they? Because each one is designed to kind of obscure the conversation and really obscure the part that you really want to know, which is, what am I getting? What is the total cost?
Right.
I think it's important to talk about what the average American is paying today in healthcare before they ever even use it. So these numbers blew me away. Yeah.
Absolutely blew me away. And what's interesting about these numbers is that I think that there was, like, over the past 2 years or so, there's been some chatter, like, you know, maybe online or just at the water cooler or just, you know, in Bible study groups or like whatever, where people have talked about, oh my gosh, this year my insurance, like, premiums, like, everything's
skyrocketed
changed.
Or they
like,
went up.
Yeah, every, you know, things have tripled, things are doubled, or now people are actually looking at, I heard conversations where people are actually looking at, like, oh my gosh, my family of 4, now our insurance premium is X. Mm-hmm. And so, you know, and I think most of the time I heard about it kind of in a monthly figure, but it's crazy what you're about to say on an annual figure.
Yeah, without diving too deep into why insurance premiums are going up substantially, they are going up, and they're going up faster and faster. And I'll tell you, it all relates back to something right around, I don't know, let's call it 2020, March maybe, or March to, you know, June. That there was something that happened and something that people chose to do. I say chose to do, that's affecting health in a large way, and it's nobody's talking about it, but it's making healthcare costs go up substantially. People are getting strokes at a higher rate, heart disease at a higher rate, blood clots at a higher rate. It's causing turbo cancers at a higher rate, and then we're all paying the cost of that.
Right.
Because that's what the insurance company does. They go, all right, what are we paying out? What are we taking in? Oh, we got to up premiums because we got to be profitable. That's what good business is profitable. Nobody goes into business unless you're a non-profit. You go into business to make money.
Right.
Pay your employees well, provide a safe workspace, and the company itself should be profitable so that it can sustain business. But the average family health insurance premium in 2025 hit $27,000 annually. So that's the average cost of healthcare for a family in 2025 was $27,000. Before you go, Dr. Ryan, we don't spend $27,000 on healthcare. We have good insurance. Somebody is spending $27,000 on health insurance for you and your family to have health insurance. So if it's not you, go back to work on Monday and thank your employer.
Right.
Because the average employee is spending about $7,000 of that out of their own pocket.
Right.
And that means that the average employer is paying about $20,000 for your family to have that health care coverage. Now, if you're self-employed, you feel the real weight of this.
Yeah.
You're paying $27,000 on average for your family to have health care. And that's substantial. The crazy thing about this, and I really want to talk about this part. I mean, that's your part. You know, $7,000, $8,000 a year. We're talking about $500 to $600 a month for a lot of people. But I want to talk about this. The weird thing is, notice this: that all that money bought you was the price of being allowed to play the game.
Which just full stop on that, because that's crazy. Like, it's crazy. It's like your buy-in. It's like your membership to the country club. It's your ante.
It's your ante.
It's your, like, it's just,
because, and what
you
I mean,
don't even get anything.
Yeah, what I mean by that is you're spending $27,000 a year, and you go, all right, I'm going to take this card now, and I'm going to go to the doctor, and it's all covered. But what the insurance companies have decided is, no, when you come in, the likelihood of that costing us something substantial. What if it's a surgery? What if it's $100,000 surgery? We're covering 5 family members at $27,000. One of them comes in and there's something really wrong going on. We're hedging the bets. They're playing a betting game on what is it going to cost us long term, or what is it going to cost us over the next 3, 4, 5 years if somebody gets diagnosed with a condition. Diabetes, for instance, somebody's going to spend $600,000 over a lifetime if they get diagnosed with diabetes. Bare minimum. So when you're buying this healthcare insurance, you come in, you have this idea of my premium covers my healthcare. Your insurance company is saying, no, your premium covers you getting in the door and having access to services that we're not going to make you pay for up front that will bill your insurance and bill you on the back end.
Right.
And that's where the whole shell game, the cup game starts.
Right. And one person in USA Today likened this expenditure on an annual basis to it's the equivalent of buying a new car every single year. That's what the expense is, right? It's like to pay for a family of 4 to do this. It's every single year buying a new car. I don't know about you, but I don't buy a new car every year.
No, my cars are multiple years old.
Yes.
So our oldest car right now is a 2016. So
Right.
that's 10 years.
Right.
So cup number 2. So cup number 1's your premium. So what's hiding under cup number 1? Is that what I'm paying for? And they go, oh, you paid $27,000. You lift up cup. Oh, the ball's not there. That means, guess what? You don't get any services yet.
Right.
So number 2, you walk in the door. Cup number 2 is what we would refer to as the deductible.
Yeah.
So now the deductible, you come in the door and you or your employer have together paid $27,000 annually. You walk in the door and you find out, hey, you need, $1,000 worth of services, care, diagnostic testing, exams, x-rays, etc. But you have a $3,000 deductible. So what that means is somebody's already paid $27,000, but you're going to pay the next $3,000 before you're even to the point where you get anything covered yet. So cup number 2, the deductible, this is the part where you find out that even after paying for coverage, you're still paying full or near full price for that coverage out of pocket until you hit a number. We've seen that number be $3,000. The lowest one I've seen recently is $3,000.
Yeah.
$5,000.
$5,000,
$10,000 pretty easily. We've seen $15,000.
Yep.
High deductible plans. Some of those are crazy. And so then cup number 3 is the last one. This is crazy. And this is the part that to us looks more like a discount than coverage.
Right.
Is that you are going to end up paying a copay on top of that. And so when does the copay fit in with the deductible? How does this all play together? That's part of the game. So I just really want to talk about this, but that copay really only applies after what's left under cups 1 and 2 is gone. Oh, nothing underneath there, nothing underneath there. And it's the smallest cup, and it's the only one that people really talk about. So people come into our office, and they say, I have a $20 copay.
Right.
And they told me I get 20 visits with chiropractic. So what do they do in their head math-wise? They go 20 times 20. Mm-hmm. 20 times 20 is $400. I'm going to get $400 for 20 visits. That sounds like a deal, right? They've already paid $27,000, or somebody has. They're coming in the door, and then they find out I have a $3,000 deductible. We don't give out $20 adjustments. We bill out adjustment. There are places that do. We fix $20 adjustments. But what happens when somebody comes in our door, the average cost of care in our office for a corrective patient is somewhere around $75, maybe even a little more per visit for really good corrective care. And then the average cost of maintenance or wellness care in our office is less than that, because those patients have graduated in that care. They're easier to take care of. And so we try to keep care affordable, but somebody comes in, they go, I'm going to only pay $20 for this $75 service.
Right.
But their deductible says, no, you're going to pay the first $3,000. And as you're paying for those first 20 visits, full price that we have to bill the insurance companies, because we have to bill you the same that we bill them. As you're paying for this, then what happens is that's chipping away at your deductible. But when you're done, those 20 visits that you've used, you've already paid for those. And then you think, oh, I paid the first, 2,000 or 3,000. Now I get to use those 20 visits. No, they counted those 20 visits in the initial part that you already paid. This is why when I talk about the shell game and them moving it around and people come in the door thinking, oh, I have pretty good coverage, at times we have to tell them, like, and this is the hard part to hear, and I hate it, but I had to settle with this in my own head, was that the insurance card has become much like the discount card that the neighborhood kid knocks on your door, says, excuse me, Mr. and Mrs. Berlin, I play for X, Y, and Z football team. Would you like to buy this discount card that for all the local restaurants in the area, there's 40 of them listed, and if you pay me $50 today to sponsor my team, you can go around and get 20% off, 25% off, a free pizza over here or this over there. And unfortunately, that's what this whole insurance thing has been relegated to.
And that's best case scenario, because 50% of the time, you're actually buying a coupon book that allows you to pay more. for the exact same thing that you could go in and you could pay less for.
Pay cash for.
That you could pay cash for. And, and honestly, it depends on the insurance. It depends on, all of it. It's a real, conundrum getting in there and figuring out, but which is what we do. We get in there and we figure it out. But sometimes it's not even discounted. Sometimes it's like, wow, this actually
is more. It could be your copay could be $60 and you want to come in and you want to use it towards adjustments, and we say we charge $55 for a wellness adjustment, and your copay is $60, and you're like, but I got 20 visits covered, I want to use it, and we're like, yeah, we could charge you $60 a visit for 20 visits and bill your insurance. Our cash rate for wellness care is $55.
Yeah.
And that's really crazy. And here's what I like about this is that it sounds negative, but the reality is the healthiest people I know are the ones who see it, recognize it, and then step outside of this paradigm. And it doesn't mean you give up your insurance. Your insurance is valuable if you ever have something major going on.
Sure.
If you ever have a heart attack, if you ever get diagnosed with a serious condition, you're going to spend $250,000 trying to get alive. Right? But the reality is that the healthiest people I know are the ones that step outside of it and they look at their health insurance as what it is. It's like emergency. When you're in your car, the only time you use your car insurance, and when I liken it to the car industry, people are like, oh, that makes sense. The only time you're going to use your car insurance is if something bad happens.
Right.
They don't pay to change your oil. They don't pay for the car wash. They don't pay to brighten, shine your wheels.
No.
They don't pay to wash the undercarriage when you drove down a dirt road for the last 2 weeks. They don't pay for gas. They don't pay for upgraded gas if you wanted that. They don't pay for fuel conditioner. They don't pay for any of these things. But what they do pay for is if somebody slams into you, or if you accidentally run a red light and bump somebody else or rear end somebody, they will pay to fix something that shouldn't have happened, that's broken, that's damaged beyond what your expectation was.
Right.
When it comes to your body, you have the responsibility and I would say the benefit of taking care of yourself in the way that you want to, as long as you don't subscribe to the idea that you're dependent on your insurance.
Yes.
That's the message. The silver lining in all of this is that the things that actually keep you the healthiest and the things that add the most to your health, the things that are the most beneficial to you, being healthy and not needing medical care, are the things that you actually have control over, and they're the things that you actually reach into your own pocket and pay for. And listen, that doesn't sound fun. I say reach into your pocket. Everyone's like, they grab their pockets. But you reach into your pocket to pay for things that you want all the time.
Right.
Whether it's new clothes, new shoes, school you want your kids to go to over another school, or whatever it is, there are things that we're happy about spending money on. I think we have to shift our mindset of going, if I buy organic food versus, processed food, I'm happy about it.
Yes.
If I buy real health care, something that's preventative, something that's building health, something that's building wellness, that's taking care of me in real time, taking care of my family so that they don't get sick, we should feel good about that.
Yes.
And we should be like, hallelujah, I'm happy to exercise my right outside of the system.
Yep.
Right? Yep. Imagine if the government said, hey, you guys are all going to pay into a kitty every year. Everyone's going to pay in. And the average American spends X amount of dollars on food every year. So everyone's going to pay in the average. And then we're going to distribute out cards to you guys. And then you got to go buy your food with that card. But here are the approved foods. I'd be like, no, we're not doing it. That's essentially what they've done with healthcare.
Right. And what the mind-boggling thing about healthcare, like if you look at it like that, like if you understand it, if you liken it to car insurance, if you liken it to this idea that you there's a system that says like, here's what we're paying out and here's what we're doing and you're paying into it, and getting in the mix of that system, that's a whole nother decision. There's lots of people who choose to just operate outside of that system, which is great, I think. And I like seeing these counterculture things pop up where people are like, I'm not doing it anymore because this seems like a scam. Yeah. But what I will say is that inside of that system, thinking about it in the way that really shows if you're going to let insurance dictate your care, understand that. Like if you're just looking at it from insurance dollar amounts on a spreadsheet and you're like, how much is insurance going to pay out? What is it going to pay out the most? Like, where am I going to get the most benefits out of this? Like, you're going to need to have a serious disease. You're like that. That's how insurance pays the most.
Yeah.
Right. Like if you're looking at it just from a numbers standpoint.
Yeah, that's a great point.
I think the question is that what you want for yourself?
Yeah. Well, elaborate on that for a minute. I mean, I get what you're saying, but go there for a minute. They pay for disease care.
Yes.
All right. So if you likened it to car insurance, it'd be like, how do I get the most out of my car insurance? I think what most of our goals are how do I have car insurance?
And I hope
I don't want to pay the most, but how do I have car insurance, enough coverage to where if I get into an accident, my car is taken care of, anybody in my car is taken care of, liability is taken care of. If I hit somebody else, they're taken care of. I want to have protection. That's what it is, protection.
Right.
But if you want to get the most out of your car insurance, you wreck your car.
Yeah.
And you hit somebody else. You go to the hospital because that's when they're going to pay the most.
Yes. And we're about to have a new driver in our house and we're going to insure him, right? I hope he never uses it.
Yeah.
I hope we never,
the goal should be to never use your health insurance.
I hope we never use that car insurance.
That's interesting.
And I have the same thought process in terms of, the
health insurance,
the catastrophic health insurance that we have. I hope we never utilize it. I hope it's never utilized. But in the cases that we do, I would never follow the parameters of what my health insurance says that they're going to cover to dictate the care that I'm going to receive.
That's good.
So regardless of health insurance saying like we're going to, we have an arbitrary number of chiropractic visits we're going to give you. We don't know anything about your spine. We don't know anything about your life. We don't know anything about your conditions, but we have an arbitrary number or a consistent number across the, thing, 12, 20, whatever the number of visits are.
Don't breeze over that. So what she's saying is you're with Blue Cross Blue Shield. You're with Anthem. You're with Cigna. We're not picking on any one. These are just names of insurance companies. And your insurance company and your employer or you sat down and said, this is the plan we're going to pay for. In that plan, there's coverage. And in that coverage, under the chiropractic term, we're chiropractors, so we talk about chiropractic. When it comes to the chiropractic side, they go, you get 20 visits a year. They know nothing about your spine.
Nothing.
They know nothing. They haven't taken an x-ray. They haven't done anything. So where did they come up with that number? They're just arbitrarily saying, this is what we're willing to risk or invest in you. And you think, and I would think, oh, I get 20 visits a year. But then, again, the shell game comes, deductible, copay. So those 20 visits.
I would argue that they've introduced another shell, which is prior authorization, medical necessity.
We're going to decide whether you actually need those visits or not.
Your doctor's not deciding. Your doctor's not deciding. We're deciding.
Yeah, they're already deciding the limitation of how many they're going to cover, and they're deciding how many and how often you get to use them. So what we're saying is when you step outside of that paradigm, we have lots of patients who get adjusted. We have patients who get adjusted regularly, weekly, 50 visits a year, 50. So even if their insurance covered 20, they're getting adjusted 30 times more. Why? Because they value it. We have patients who pay that out of pocket gladly because they go, this is probably the best thing in my healthcare outside of exercising, eating well, things that I have control over that I can do for myself. Getting adjusted is one thing I can't do for myself. I can show up, but I have to actually have a skilled, trained chiropractor. And so I invest my money into doing this, keep my nervous system, my body healthy, healing, everything well, and they see it as a value. And then when it comes down to insurance and they start realizing how convoluted it is and what their copay is, whatever, they're like, I'd just rather pay you guys directly. I'm not telling you that's what you should do. I'm just telling you that if your mindset is this one of like, my insurance, what's it cover, then you're already asking the wrong question because your insurance is set up for disease. Your insurance is set up for sickness. Your insurance is set up for trauma. Your insurance is set up for the broken bone. Your insurance is set up for the scary diagnosis you might get one day. Your insurance is not set up to keep you well. That is not what it's about. And so we tell people that when they step outside that paradigm, they really look at it. And the cool thing is the cost. And I love this because I talk about this. If you got adjusted in our office 52 times a year as a weekly patient. I've been a weekly patient of chiropractic care my entire life. But if you've been adjusted 52 times a year and you multiply that out over what your average chiropractor would charge over a visit, you're spending literally a fraction of the cost that you would on healthcare insurance before you ever use it. I mean, if you were to pay $3,000 a year.
Yeah.
For your whole family to be insured and never use your health insurance, we said on average is $27,000 a year.
Right.
Your whole family could get adjusted multiple times a week and be under half of that.
Yeah.
And your health insurance, you haven't done anything yet.
Yeah.
You haven't even hit your deductible. You haven't even made a copay. You haven't even figured out what your co-insurance is. And so it's just a very interesting thing. We wanted to just kind of provoke that a little bit and get you guys thinking differently about your health. This is what we did. So we decided as a family to kind of go outside the box a little bit, and we started investigating health sharing programs. I'm not anti-insurance. We utilize insurance in our practice. We know most employers pay for insurance. But for people, if you're looking to go, all right, what works better for me? We started going, are there companies out there that pay for the things that I value? The company that we used happened to pay for at-home births, and there is not an insurance company out there that would pay for an at-home birth. The company that we use would pay for prenatal supplements, and they'll even pay for supplements for somebody's health as long as it's actually addressing a need in their health, and we submit something and they decide whether they're going to pay for it. We've had patients get their supplements covered. If you have insurance, you have things like HSAs. Those are great. Those are awesome things to use for chiropractic, for supplementation, for all those things. So I'm just challenging you guys to think outside the box and think about it in terms of that shell game. Ask yourself today, what is my premium? What is my family's healthcare premium? Number 2, what is our deductible?
Yeah.
So take your premium.
Yep.
Again, we use the number 27,000. That was a Googled number.
Yep.
Take a deductible, call it $3,000. Add that to the 27,000. So that's $30,000 that somebody is paying before anything even gets addressed in terms of, I don't want to call it free, but covered benefits, right? What people think is they think it's free. Like, I'm going to go get this covered. You see this at the end of the year. I'm going to go get that MRI because I've met my deductible.
Right.
But then there's the copay on top of that. And so start looking at those and investigating them, because we're in the summer right now. You're going into the next part of the year, and this is the time where people start thinking and planning for next year, and take a look at, like, what is that actually covered? Then the last part I would say is, what are the goals for your family?
Yes.
What do you want? What is your objective? Is your objective healthy? Is your objective regular chiropractic care? We have patients that get started under care, and if they ever are questioning how to shuffle this around, I always ask them, what's your objective? What's your goal of getting your kids adjusted? And they usually will say, I want to get them adjusted regularly. I would love to get them adjusted at least every other week, at least weekly, at least monthly, whatever their goal is. And then they go, and then they start talking about insurance, and I'm like, whoa. What is your goal? What do you want to do with your family? Let's try to help you navigate within that. We might have to be honest about whether your insurance is going to cover it or not, but let's talk about your goal and what that looks like. And then frequently we'll just put a number on paper and go, this is it. And then, how do we break this down? How do we make it equitable for you and your family? And I think it's a very honest conversation. The one thing I dislike about insurance is I feel like it's not fully honest.
Yes.
I feel like it's the shell game.
Yes.
I feel like it's like, oh, your employer pays this much, you get this much taken out of your check. Cool. Now I'm going to go use my insurance.
Yes.
Oh, you got a $8,000 deductible. Oh, okay, I'm going to pay that. Then I can use benefits. Oh, you got a copay over here. Mm-hmm. Okay, cool. Well, I'm going to pay that copay. Oh, it's not medically necessary.
Yep.
Oh, it hasn't been approved yet. Yep. We didn't have prior authorization, so you had it done. You thought it was covered. It was $3,000. We decided you didn't file it in time, so you owe that $3,000 now, and it's this constantly moving shell game. So I know this is not always fun to hear, but the reality is you get to choose your health. You get to choose your provider. You get to choose your healthcare. You get to choose what system you operate under. You get to choose how much of it you pour into the one system or how much into the other. And I think that once you decide that as a family, that is the liberating part of it.
Absolutely.